Okay, just some brief examination procedures to illustrate some things that we might do at the finger joints. So finger flexion is obviously a very important motion for gripping purposes. So let's have our patient show us their hands like this, forearms in a neutral position so that they're as comfortable as possible. I want you to make a fist for me, okay? And lo and behold, we've got a finger that doesn't flex fully. So, same procedure. If we visually see motion limitation, it's our job to record it. So apply your digital goniometer over the dorsal aspect of the MCP, the PIP, and the DIP, and record that limited motion. Next, same process. What's causing the movement limitation in finger flexion? Is it painful? We can determine whether or not a movement is limited by discomfort by just simply applying an overpressure test. So I'm going to lightly hold like this, and then give this joint a little extra passive movement. Give this joint a little extra passive movement. If that bothers the patient, clarify location, intensity, and character of discomfort. Next, let's study the end feel. Is there any capsular shortening at any of these joints? Very light, relaxed, comfortable grip. Test the flexion end feel multiple times. Does this stop, does this restricted movement come early and feel firm? If it's early and firm, we know that there's likely some shortening of capsular tissue. Okay? We can further clarify that with our passive translatoric motions by, again, really light, relaxed pressure. Keep your patient comfortable. Glide the finger in a palmar direction. Remember that joint play movements are very small, and it's really a good idea to confirm limitation in joint play by immediately checking the joint on the opposite side. If the movement is larger and it's softer on the uninvolved side, you've likely confirmed capsular shortening with that particular translatoric movement. One additional point, let's look at the potential for muscles to cause limitation in this movement. Hand is able to flex this far. Relax just a little, and now let's flex your wrist. Now try and bend again a little bit more. And we can give a little active assisted motion and determine whether or not the end feel has become more elastic and whether or not there's a pulling sensation outside anatomically of the capsule. Is the patient getting pulling up through the tendon and into the muscle belly? So we're progressively taking up a little bit of slack in the long finger extensors. Could release this just a little. Pronate. Flex the wrist. And now flex these joints again. If the end feel becomes progressively more elastic as we progressively take up slack in the muscle, and again, the patient feels a pulling, tugging sensation in the anatomical distribution of the muscle, we're likely dealing with shortened contractile tissue limiting that particular motion.